Hello everyone, welcome back. My name is Dr. Vijay Bhatia and today I'm going to talk about somatoform autonomic dysfunction. What is somatoform autonomic dysfunction? Symptoms are presented by the patient as if they were due to a physical disorder of a system or organ that is largely or completely under autonomic innervation and control. For example, cardiovascular system, gastrointestinal system, respiratory system, and urogenital system. The symptoms are usually of two types, neither of which indicate physical disorder of the organ or system the patient is concerned about. First, there are complaints based upon objective signs of autonomic arousal, such as palpitations, sweating, flushing, tremor, and expression of fear and distress about the possibility of a physical disorder. Second, there are subjective complaints of a non-specific or changing nature, such as fleeting aches and pains, sensations of burning, heaviness, tightness, and feelings of being bloated or distended, which are referred by the patient to specific organ or system. So, somatoform autonomic dysfunction is also known as cardiac neurosis, the Costa syndrome, gastric neurosis, and neurocirculatory asthenia. Somatoform autonomic dysfunction can be psychogenic forms of aerophagy. Aerophagy is when you keep on burping, there is excessive air in the stomach and you keep on burping without eating, without having a food, sometimes too much, and they feel uncomfortable and anxiety develops around that. There might be psychogenic forms of cough. The patient is not able to stop coughing without any underlying cause, and it happens in awkward places and situations with friends and when they are supposed to be sitting down, but it can be very distressing. The symptoms can be about diarrhea. They keep on going to the toilet even when they don't have to, or dyspepsia, uncomfortable feeling, or even pain in the stomach area, as if it is like acidity, or some kind of problems with gastric ulcer or too much acid. Or they may have psychogenic dysuria, that they complain of um, when they go for the urination to pass the urine, they feel pain, discomfort, and having difficulty. Or flatulence, that they keep on passing wind too much, even not eating or eating after anything or small amounts, that the stomach is or the abdomen is or the intestine is full up of air. Or they may have psychogenic hiccup, when they keep on having hiccup without any apparent reason and it doesn't stop, and it can be very distressing and it can be very attention seeking, and they have tried number of things, nothing has helped. And it could be just hyperventilation, that they keep on breathing very fast and deep, and it happens all the time and they are very much concerned about it. Increased frequency of micturition, it can be just a psychogenic form, that they have to keep on going to the toilet to pass the urine. They can't stop it, they can't hold it. Or irritable bowel syndrome, psychogenic. So it is just the feeling that the bowels are irritable, that they're moving very fast, they can't hold stuff very long, and if they eat something, it passes out quickly. Or pylorospasm. Pylorospasm is the lower end of the stomach. it goes into a spasm, into a contraction, and that causes distress, that the food doesn't pass into the intestine from the stomach. It remains in the stomach for a long time after eating the food. They feel full up, bloated all the time. And that can be just a psychogenic without any underlying cause to any of these. Somatoform autonomic dysfunction, what are the criteria? Criteria A. There must be symptoms of autonomic arousal that are attributed by the patient to a physical disorder of one or more of the following systems or organs. So what happens? The patient presents with symptoms of autonomic arousal, which will be palpitations, sweating, tense muscles, anxious, worried. They are autonomic arousal symptoms. But the patient is attributing these symptoms to a physical disorder, to one of the following systems. Number one is heart and cardiovascular system. Number two is upper gastrointestinal tract, which includes the esophagus or food pipe and the stomach, or the lower gastrointestinal tract, which includes the lower intestine, anal canal, and anus. And they may be involved with the respiratory system or genitourinary system. Remember, all these systems, the nerve supply and the control of these are by the autonomic nervous system. That's why the somatoform autonomic dysfunction disorder. Criteria B. Two or more of the following autonomic symptoms must be present. Number one, palpitations, sweating. The sweating can be cold or hot, so they don't have to be in exhaustion or running or something. They can be simply sitting in a nice cold room and they are still having sweating. Or it could be dry mouth, or it could be flushing or blushing. So their face is as if turning red, as if they are feeling hot, and even some sweating. And some epigastric discomfort, that is upper part of the stomach. They complain that they are having like butterflies in their stomach, or they sometimes complain of churning in the stomach for no apparent reasons. So at least two or more of these must be present for the symptoms of autonomic somatoform disorder. Number C criteria, one or more of the following must also be present. So either chest pain or discomfort in the chest, in and around the precordium where the heart is. They will actually point, I get the chest pain right in front of my heart. I feel the discomfort, the pain is there, the difficulty is there. Or they have dyspnea, that means difficulty in breathing, that they can't breathe, the air doesn't go in, they have difficulty. Or they are hyperventilating, that means they are breathing too fast, too shallow, and very quickly as if they were running a marathon. Or there might be excessive tiredness on mild exertion, so they just move from one room to the other. That is too much for them. They feel excessive tiredness as if they don't have energy. They are completely exhausted. They may complain of aerophagy, that is too much air in the stomach or in their stomach. Or they complain of hiccups. They can't stop. They will say, I keep on having hiccups for no apparent reason and lasting for hours and hours sometimes without any interval in between. Or it comes as phases, that it comes for some time and then stop for a little while and starts again and stays for a long time. Or they may complain burning sensations in the chest, as if you are having too much acid, as if there is symptoms of like gastric ulcer or hiatus hernia, and it is in the upper part of the abdomen near where the stomach is, passing right up to where the food pipe is. Reported frequent bowel movements, so they might report that they have to keep on going to the toilet and have to open their bowels every short period, sometimes 10 to 20 times a day or even longer or even more. And increased frequency of micturition, so they may complain that they have to keep on going to the toilet even though they pass very little and sometimes they don't pass anything, but they can't stop it, they can't help it, otherwise the symptoms just get worse, anxiety just get worse. And the same with the dysuria, they might complain, whenever I go to the urine, but to pass the urine, I'm having difficulty, I'm having pain, it is hurting, I can't. And the other one is feeling of being bloated, as if there is too much air in the intestine, or there is too much food in the intestine or stomach. They feel distended or they feel heavy in their abdomen. So at least one or more of the following must also be present. Criteria D. There is no evidence of a disturbance or structure or function in the organ or system about which the patient is concerned. So if the patient is concerned about the upper gastrointestinal tract, when we examine it, when we x-ray it and do all the investigations, we do not find anything is wrong with there. Same with the heart. If you look at the heart, you do the ECG, you do the blood investigations, and you examine the heart, there is nothing wrong. But the patient is attributing these symptoms to that there must be something wrong, and they do not feel reassured, and they keep on coming back that there is something wrong, otherwise they will not be feeling the way they are. And the most commonly used exclusion clause will be if they have suffered from some kind of phobic disorders, like phobic disorders will be agoraphobia, going to the crowded places or meeting other people, or going in some places, open spaces or public spaces. Or they suffer from panic disorder. Panic disorder is sudden severe attacks of anxiety that can happen either with agoraphobia, or it can happen on its own without agoraphobia, and these severe attacks come out of the blue. So inclusions will be if it is a heart and cardiovascular system the patient is complaining about, the symptoms, and it includes the cardiac neurosis. The patient suffers with cardiac neurosis when we find that there is nothing wrong with the heart or the circulatory system, the blood pressure, everything seems to be fine. However, the patient keeps on complaining about, I got a pain in my heart, just outside the heart, I feel breathless, it is discomforting, and I can't breathe. So they will try to simulate the symptoms of a person who actually suffers from heart problem, but in that case they do not suffer from any heart problem as examined by the doctor and done investigations. It seems that they know somebody who suffers from heart problems either when they were growing up or later on in their life, and at this stage there is some kind of psychological trauma. They are trying to pretend that they suffer from similar illness which their relative or somebody they know has suffered, and they try to present those symptoms, but on examination we do not find anything. And the other names for this is neurocirculatory asthenia, or another name is the Costa syndrome. Upper gastrointestinal tract, they will include psychogenic aerophagy, patient complaining too much air in their stomach and they have to keep on burping. And same with the hiccup, psychogenic hiccup, We don't find any reason why the person should be having hiccup, but the patient can't stop. We don't know the reasons, but the patient cannot stop having hiccups, and it is called psychogenic hiccup. And these are called gastric neurosis. The person keeps on complaining about symptoms related to their upper gastrointestinal tract, again as if they know somebody who has suffered from this, but they won't tell, but they will present themselves with those symptoms. However, on examination, there is nothing found there, and these symptoms are basically just sometimes anxiety symptoms, as we discussed in the first category. The same applies to the gastrointestinal tract. We call it psychogenic irritable bowel syndrome. This is quite common. The patient has to keep on going to the toilet. Patient believes that they are bloated even after eating a small food or anything, or even a water. They can't retain it. It passes out quickly, and sometimes the food is not even digested properly. So they have number of symptoms, and sometimes even discomfort, like there is pain there. They can hear the noise in their bowels movements. So it is psychogenic irritable bowel syndrome, or sometimes even psychogenic diarrhea. Here the person actually complains that he has to keep on going to the toilet, and they actually open the bowels every time they go, even if it is a small amount. The other syndrome related to the lower gastrointestinal tract is the gas syndrome. The person complains excessive gas. They keep on passing wind from the anus every time and they sit with somebody, or they eat something, or even if they don't eat and they can't help it, they don't know what is wrong, they insist that there is something seriously wrong with their lower intestine. However, on examination, even doing the barium studies or ultrasound scans, or even with the endoscopic camera examinations, there is nothing found. The other system is the respiratory system, the psychogenic hyperventilation. Patient does not stop having hyperventilation. They keep on hyperventilating, breathing fast, breathing shallow for long periods of time for no apparent reason. And when you ask them, they will say that there is something wrong with their respiratory, with their lungs, with their windpipe. There is something wrong there. Please investigate. And when you investigate with x-rays and everything, there is nothing wrong there. With the genital urinary system, again, there is person will complain that I have increased frequency of micturition. I need to keep on going to the toilet. I can't stop. If I don't, I will wet myself. And when they go to the toilet, they actually do pass some urine, but sometimes they don't even pass anything. But they are very much obsessed with this feeling that they have to keep on going to the toilet to pass the urine. Or the other symptom could be that whenever they go to the urine, they pass, they are having difficulty. It is painful. It is not comforting. It is not relieving, as if some urine is left there, as if some kind of infection is there. But when you do all the investigations of urine and the system itself, you do not find any apparent fault with the system. Therefore, and again, it sounds that they know somebody who has suffered from these symptoms in the past, but now they are presenting with similar symptoms, which is as they assume will be related to the underlying system, genitourinary system. But on examination, investigations, nothing is found. Hence the term somatoform autonomic dysfunction. These disorders are believed to be psychogenic in origin, and we believe you might have noticed that in the 3 videos I produced on, one was the somatoform disorder, where the person will complain about the physical symptoms, and these physical symptoms, they are very wide. They might be from one system to the other system to the third system, again from the heart, from the respiratory, from the gastrointestinal, from other, and they must have at least 6 of these symptoms present over a period of 2 years, and they are basically just symptoms, complaints about certain things across a number of wide areas of systems. And there is nothing wrong there when you investigate, and even if you tell them there is they don't accept the reassurance and they keep on getting help from different people. In hypochondriacal disorders, what happens is, rather than presenting as symptoms, they tell you that I suffer from cancer of the stomach, cancer of the lung, or something like that. And they might also complain about that my nose is too big, I want the reduction, my breasts are too large, I want the surgery to be done. It shouldn't be like this. So they are either focused with a disease, particular disease, or certain part of the body that they are not happy with. My buttocks are too large, I want reduction. My stomach is too big, I want the fat to be removed. And very much focused, and if you don't help them, they will go and get the help from anywhere they want, even the local healers. But these people are focused with the disease. Somatoform or somatization disorder are focused with the symptoms, and somatoform autonomic dysfunction, they present with symptoms which are related to the organs or systems which are regulated by the autonomic nervous system, like heart and cardiovascular system, or gastrointestinal system, or respiratory system, and they believe that the symptoms are related with these. And however, on examination there is nothing wrong with that, and they may present with symptoms which are basically related with more anxiety rather than underlying any physical disorder. And the management, because these are much more to do with the underlying assumptions that this disorder presents like this, and therefore they go and present these symptoms in certain ways, because there is nothing underlying real physical cause to it. Therefore there is no treatment for those. If there is nothing wrong, there will be no physical treatment. However, these patients will benefit from the psychological therapies because they are very much distressed, and when they are distressed for some time, it can lead to anxiety symptoms, it can lead to depression, and it can lead to even preoccupation, to the extent that it will affect their daily functioning, and therefore they need some kind of support with the psychologist who will understand them and explain them, and may have some kind of cognitive behavior therapy or other therapies like counseling or mindfulness or relaxation techniques. However, if they do develop underlying depression or anxiety, then these disorders, depression and anxiety, should be treated appropriately with either medication or with other talking therapy. Thank you for listening. If you like the video, please press the like button, share with your friends, and subscribe the channel. There are more videos about mental disorders. I see you again.